Good evening, everybody. This is your doctor, Dr. Alvin Jeffrey Counts, podiatrist in Georgia. Come to talk to you real quick about stinky, smelly, sweaty, flaky, red type feet, excessive sweating type feet. I know a lot of you, a lot of athletes or a lot of non-athletes are dealing with this issue. The medical term for this type of feet is called tinea pedis. Tinea pedis, or as you know, is called athlete's foot. And what athlete's foot is a fungal infection of the feet. The type of fungus that infects this feet are what we call a dermatophyte. And the most common dermatophyte is called Trichophyton rubrum, which is the same fungus that infects the toenails that causes what we call onychomycosis or fungal nail infection or so. Same fungus that infects the feet is most common in affecting the feet, is most common affecting the nails. Other type of funguses that infect the feet that can cause what we call tinea pedis or athlete's foot includes epidermophyton, mycosporum, and trichophyton mentagrophytes. These are three other types of fungal infections that can cause athlete's foot, tinea pedis, in the feet. The common areas where you get this tinea pedis fungal infection within the feet include interdigitally, in between the toes, and on the soles of the feet. A common type of symptoms that you see when you have these fungal infection, and you get this chronic plantar scaling in the bottom of your feet, which looks like a moccasin type distribution on the foot. You get redness, you get scaling, you get a white, wet looking type of feel to your feet. Look to your feet, especially in the fourth interdigital space around this, between the fourth and fifth toe. You get that white, flaky type maceration or flakiness in between the skin that causes itching and redness a lot of times, like I said from earlier. These are common symptoms that you get for fungal infection. Tinea pedis, this athlete's foot as we call it, arose in the 1900s, around that time due to war, and it was commonly seen in a lot of military soldiers with their boots or so, with that inclusive shoe wear that they had, which was brought from over in Southeast Asia, on through Europe on over to America or so. You can now get this fungal infection in the feet in health clubs. As you say, you get them in war. You get it through traveling to other places. You get them through walking barefoot in public restrooms or in public showers. You can get this this can be spread from animal to animal. You could get these from swimming pools, walking barefoot around swimming pools. You get these from walking barefoot around locker rooms, and walking also barefoot in unclean shoes that they can get from somebody who already had athlete's foot, or from you if you had a previous athlete's foot infection in your feet that was spread to your shoes and then reinfected yourself. So hygiene is very important when you're dealing with this type of infection. A lot of times if you go see a doctor, this diagnosis is normally made clinically. Like a lot of doctors who deal with this situation are able to spot these symptoms and spot what's going on and be able to diagnose what you have. Sometimes if that's not possible, we can find out what's going on through biopsy and through cultures to be sent to microbiology, and we can look under the microscope and notice what we call hyphae, which is pretty much which is part of the fungus structure or so. So with that being said, I know a lot of you think that that athlete's foot or the fungal infection is just located to your feet, but that's not true. Y'all know what we call ringworm that you can get on your face, that you can get on your head, you can get on your body. It's caused by the same fungus, Trichophyton rubrum. So ringworm and athlete's foot caused by the same bug. Tinea barbae, where you get fungal infection in your beard or so. When you get that little raised borders with the flat central center, that can be red, flaky, itchy. Same bug. Tinea corporis, Tinea cruris, which is jock itch. Same bug, same fungus that infects the feet can infect the jock area. Especially a lot of athletes get this issue. And you also have Tinea nigra and Tinea versicolor. These are all fungal type infection, but I'm not going to go into those. But so dealing with athlete's foot, it's a fungal infection. What else can I say? So, with that being said, when you're diagnosed with what we call athlete's foot, there are multiple treatment options, and normally topical antifungal medication is normally the cure in order to treat these infections or so. They're very successful, and normally the key is that you want to apply these topical antifungal medications such as clotrimazole or so. You can go to CVS, Walgreens, get something like topical Lamisil, sulfatic tinactin. There's many different types that you can get, but the key is that you want to apply these twice a day after you clean your foot thoroughly, and not only clean and wash with soap, but dry your feet thoroughly. Then you will apply this topical medication on your feet. You want to apply it twice a day, and then you want to continue to apply it for 2 to 6 weeks after the symptoms have gone away to make sure all the fungal infection is gone. I know I read a study said that currently 15% of the world's population has what we call as you know, athlete's foot or tinea pedis, caused by Trichophyton rubrum mostly. And it's been said that up to 70% of people in this world will at some time be infected by athlete's foot or tinea pedis. So hygiene is very important, and knowing the symptoms and knowing how to prevent this and how to treat this is very important. Let's say you use this topical medication and it doesn't seem to work or so, and the symptoms seem to appear even after you used it for a month or two or so. Then you want to try to switch to what we call oral Lamisil, something a little stronger, which is terbinafine is the term for oral antifungals that's most effective, and that should normally help. It's a little bit stronger and it's oral. Other type of medications are like griseofulvin, fluconazole, itraconazole. These also have been known to treat tinea pedis, athlete's foot. So some of the side effects that you can get from sometimes using these is a little bit of gastrointestinal upset. It'll affect your gastrointestinal system a little bit, but not too many other symptoms I see for that. And also, if you're on, let's say, if you have liver issues, or if you're on like cholesterol medication, which all metabolize in the liver, that can raise your liver enzymes. So, but when you're giving something oral like this, you don't have to give it more than 14 days. That's where it's indicated for. So, with that being said, prevention is the key to not getting this, and the way to prevent yourself from getting these type of issues is to make sure that when you go to these locker rooms and when you go to these public restrooms and bathrooms, that you always have a proper shoes or sandals on, that you do not walk barefoot. Get away from these cotton type socks that absorb moisture. You want something that's kind of wick away moisture and make the environment not so pleasant for fungus. You want to wear something like dry fit socks or acrylic cool mat type socks that wick away moisture or take moisture away from your feet, which makes the environment less suitable for fungus. Another thing that's very important if you either prevention or if you have fungal infection, so you don't reinfect yourself, you want to Clorox bleach your floors and your showers. This bleach is not just Clorox bleach, but chlorine bleach your floors and showers. This has been shown. It's been very effective in not only killing fungus but killing the fungal spores or mold spores that are pretty resistant to a lot of other different types of cleaning disinfectants or so. So chlorine bleach, very important in killing off this fungus that like to hang around in moist, wet, dark environments. So and some other things. And let's say you're a person that does not like to take medication or even apply topical medication. Some other things you can do is you can apply what we call potassium permanganate in some warm water. That helps to, again, potassium permanganate. That's been helped to dry out the feet and kill off the fungus. It makes the environment very unpleasant for fungus. Another thing you can do is get some very cheap alcohol, put it in some warm water, and soak your foot for about a good 30-40 minutes. Before you know it, it's going to wipe away all that flaky, scaly red skin or flaky, scaly, and red type skin, itchy skin, and help to kill off that fungus infection. Your foot will feel smooth as a baby's bottom, as they call it. How overused that was, but it helps. And some other things that you can use, and not as effective as some of your topical like Lamisil or so, but which are very effective. Medication like miconazole. That's another good one, miconazole. It's also it's actually been shown to be pretty effective in treating what we call a bacterial infection that mimics a fungal infection, which is called erythrasma. So miconazole is very good for that. And it's not as effective for fungus, but it can still be used to treat fungal infection as well as erythrasma for that. So anyways, let's say you do all these methods of treatment, including let's say you use the topical, you use the oral medication, you bleach your showers, you bleach your floors, you Lysol your shoes, or you disinfect your shoes, or you wash your shoes thoroughly, you get a new pair of shoes, you're wearing the right socks, and you're doing all the right things, but you still continue to have this white, scaly, flaky skin that's itching all the time, then it may not be a fungal infection. So this is why it might be important to go see your doctor at this time, at this moment. If your topical your topical and oral medication and doing all the preventative methods don't work, because other differential diagnoses that look similar to what you have. Erythrasma was one. Allergic contact dermatitis is another. Dyshydrosis is another. Psoriasis is another. Eczema is another. So if you've done all these things and it doesn't have any effect, then you might have something else that's going on that's mimicking athlete's foot. So go see your local podiatrist and they will help you to determine what's going on. They will at least take some cultures and send off to the lab to find out what's going on. So don't be scared to go get some help. All right, and next thing I was going to talk about is sometimes a lot of people who have these issues also deal with what we call sweaty feet, or the medical term is hyperhydrosis. That excessive sweaty feet, your socks are always damp or wet, no matter if you're just sitting at home or working, your feet your socks are just wet, your shoes are wet from just excessive sweating, which makes the environment very suitable for a fungal infection, athlete's foot. So if you have these issues, there are some things that can be done. So if you have excessive sweating to your feet that also cause your feet to smell sometimes too, certain things you can do to prevent some of that sweating, that excessive sweating. You can apply antiperspirant to the bottom of your foot. or and in between your toes. Antiperspirants like Secret, Gillette Degree, Arid, Sure, some prescription types like Perspire X, Certain Dry, Hydrosol. You want to make sure that they have either metallic salts, aluminum, zirconium, trichlorohydrex, and aluminum chloride hexahydrate. Those are some of the ingredients that help with preventing the excessive sweating. It kind of stops the what we call the apocrine cells or from producing excess sweat. Or so I don't want to go into the medical terms, but that's what they do. Other ways to treat, if you don't like antiperspirant, like something like Gold Bond, those powders or so, antifungal powder, they kind of absorb a lot of that sweat or so. So your foot not so excessively sweaty. Of course, you want to make sure that you're wearing socks that kind of wicks away moisture. That helps too, like Dry Fit, Cool Max Acrylic, something like that. Another treatment for hyperhidrosis is ionophoresis. That's another medical term. What ionophoresis is like a medical device that's placed in kind of like your body submerged, your foot submerged in water. It's like a metal device that's a medical device that's placed in water, and it produces like electrical current or so while your foot is submerged in water, and the current is kind of delivered to your feet, and it blocks your sweat glands from working. Now, it only does it temporarily, but it does stop your sweat glands from working, and it prevents that sweating going on. I recommend that you have to do this on a weekly basis until the issue kind of calms down. Preferentially daily would be the best, but if not, like every few days, once a week, it would definitely help in temporarily stopping the excessive sweating to your feet. And if that doesn't work, you can always do Botox injections. Botox injection to the feet. Botox injections also have been shown to like stop sweating in the area. It pretty much paralyzes those sweat glands or so they don't produce any sweat or anything like that. So that's another option. Now, Botox injections, as you know, when dealing with the face or so, or dealing with wrinkles or so, they wear off within 3 to 4 months. So repeat injections are needed. But Botox injections have been shown to prevent that excessive sweating. So take that in mind. Last thing about ionophoresis is largely used a lot of time in athletes in helping dealing with excessive swelling and pain due to an injury or so. It kind of relieves the swelling and pain to certain joints and certain injuries or so into the body. So ionophoresis is very effective and not only helping with hyperhidrosis but also dealing with athletic injuries. All right, guys. Well, I know it's late, but it's the Christmas holidays. I hope you guys got all the presents you want. I hope you guys didn't spend too much money and go broke like me. But love you guys. Make sure that you subscribe to the button if you're not currently on YouTube with me. Subscribe so you can get all the information, because I do these talks weekly, whether it be on Facebook or YouTube, and pass it on to somebody else who has these issues. At least they get a baseline information of what's going on, so they know what to do and what steps to take. And like I said, when push come to shove, and when in doubt, go see your local podiatrist. I mean, the training that we get is incredible. A lot of podiatrists are across this nation can really give you some good help. So, anyways, take care. Again, if you have any questions, you can always email me at jeffcfau25@hotmail.com. Again, that's jeffcfau25@hotmail.com. You can email me anytime. You can find me on Facebook at Alvin Jeffrey Cowens. Any questions, hit me up. I'll respond to you as soon as possible. I do this for the love of educating and helping those and helping others. I love it. I want everybody to be healthy out there. All right, take care. Love y'all. Good night. Have a good time.